Hi everybody, we're here today with another amazing before and after.
Thank you for joining us.
You can see our patient here. She is a very healthy female in her mid-20s. And despite the fact that she's already past those teenage years, she was really struggling with ongoing acne. So part of her journey, step one, was obviously to clear the acne, which we did. Our preference is actually to treat acne medically first to make sure that that really active component is cleared. And we do that before we start diving into cosmetic treatment options with lasers. We just find that long-term, that gives us a much better clearance of the skin.
As you can see, there's a lot of inflammation. That redness and the swelling is embedded around those sebaceous hair follicular units, and it's quite congested, and it's essential to get rid of the inflammation before we start embedding on some laser treatments for acne scarring and texture improvements too.
Exactly, which is actually a noteworthy point right there. So people often come in with a lot of this redness and inflammation. So you can see that the active acne is now cleared, but they're left with this red inflammation. So of note, as dermatologists, we actually don't call that acne scarring. So we know that we can treat that inflammation very effectively. And in fact, what we call acne scarring is that textural change that we see after the fact. So it's where you see small little pits, rolling indentations. That's actually what we call the acne scars.
Mm-hmm. And then that's where you hear different names also, like ice pick scars and boxcars as well.
Yeah, actually, should we dive into that? So we have like three major terms that we kind of like to classify these scars. So there's ice pick, like the term describes, it's where there's a small little sharp pit in the skin. So it looks like you took a little dagger and dug it in. The second is the boxcar.
Mm-hmm. Boxcar is almost like a jagged little nondescript shape where it could be very, very jagged and there's a sharp cutoff. I like to describe to patients the fact that the surface looks more like a deep 90-degree curb on the edge of the street compared to, say, the curb where it gently goes down into the walkway in the middle of the intersection. So we want to smoothen out those edges of the texture of the skin.
Exactly. The boxcar is almost like you took a little miniature, little Lego bricklet and kind of dug it into the skin. So really sharp edges.
Yeah, or a cookie cutter. Yeah.
Yeah. And then the third type is what we call the rolling scars. So think like rolling hills. So rather than that jagged edge that Marnie was talking about, it's more of those smooth rolling borders.
Mm-hmm.
So every type of scar basically has a different approach.
And again, that leads us back to combination treatments for combination texture situations, which is probably more the norm than the exception.
Oh yeah, almost always, right? For acne scarring, it's a difficult condition to really treat and get that close to perfect response that we want. So it's almost always a combination. Okay, let's get back to our before and after here. So we dealt with the active component of her acne, which was fantastic. So big check, step one complete. Step two for us really was then to start addressing that inflammation. So for this, we decided to use our ND-YAG laser. We have the XLV, which is really what we consider the gold standard in the industry. And it combines two different wavelengths of light. You can set that laser to either one. One of the wavelengths is targeted for deep redness and deep broken vessels. The other wavelength is a more superficial target. And we're usually using both wavelengths in any particular treatment to really help get that redness and that inflammation under control.
It's also good to note that it's good for all skin types. The deeper ND-YAG has a 1064 nanometers, which is very specific technically. However, we know that it is safe to use in all skin types to get deep into the skin.
Right. It's from the fairest of the fair to the darkest of the dark skin tones. It's really actually very safe.
And of note, when we're looking at this particular patient's vascularity, it's a residual vascularity left over from that inflammation of the acne pimple. And it's very red. And sometimes there is a combination of different blood vessels. They can have a very venous or purpley type effect to them as well. So there can be a little controversy in terms of when people come in and they have dark marks left in their skin, but really at the end of the day, there's still a lot of vascularity in there. So if you're skin type 4 or skin type 5 or 6 and you see some dark marks, sometimes there is some underlying vascularity and we still need to go with the XLV laser to help clear that up.
Yeah, that's a very, very good point.
Mhm.
And sometimes, particularly with people with darker skin tones, it can actually be very tricky to understand when you see that area of darkening, how much of it is pigment,
Mhm.
i.e., melanin, like excessive melanin sitting in the skin, and how much of it is actually vascular. So, due to these enlarged or engorged capillaries and venules.
Mhm. Okay, so yeah, we usually do a series of laser treatments. They can be done 4 to 6 to 8 weeks apart, depending on the patient's schedule. And we'll do 5 sessions for starters. And this particular patient was very motivated and keen, and also combined that with some microneedling.
Right. So in this case, her textural damage, so AKA what we call the actual acne scarring, was fortunately quite mild. So there was some textural change, but not a lot. So we were able to use something really very gentle, like the microneedling. So not a lot of downtime, easy
Mhm.
peasy treatment. For sure, it's not going to be for everybody. So when the acne scars or the textural change is more significant, that's when we do have to move more into the lasers. And even within that category of lasers, it's really quite broad. So there's gentle treatments and all the way up to the most aggressive. But fortunately for this patient, the texture was really, I think we got in there with our
Mhm.
treatment for her active acne before she really developed really significant textural changes. So
Mhm.
we were able to combine it with just gentle microneedling, and she had a really outstanding result.
Mhm. And this is an important portion of the treatment planning, which is knowing your patient and the patient saying, here's my schedule, here's my work life, here's my social life, and I want 1 or 2 days of downtime or almost zero downtime, and I want to get right back to work. I don't want everyone in my social circles to know my business. Some people, they want everyone to know their business, but some people really do not. So, again, as Dr. Pula said, this was a gentle approach and it worked for her, and she was really, really happy.
Yes, she was.
Yeah.
And it brings up another point which just comes to mind, which is like, when is the right age or when is the right time to address your acne scarring? So it
Mm.
does come up a lot as we do our consults. So sometimes, we get a young person, let's say late teens or in their 20s, and they're like, oh, should I do it now? Should I just wait? And what we usually, our approach is we encourage people to at least do something, whatever they can, really as early as possible. So we know that acne scars, meaning AKA that textural change, is unfortunately, it's not going to go anywhere. So they can get older. Those scars really are, unfortunately, are not going to improve on their own. And we know that skin healing, production of collagen, all those biologic processes that we're trying to induce with our treatments are actually more active as we're younger. And so it makes a lot of sense to get on this when you're younger rather than sort of pushing it off, delaying, procrastinating. And like Dr. Fisher just pointed out, of course, life happens and we all have demands and
Mm.
things that we have to do, but we can work around people's schedules and what they're doing. So life can continue on while you're still progressing to meet your goals in terms of improving that scarring.
Mhm. And there's no reason to think that when a clinic such as ours or your expert opinion suggests 3 to 5 sessions, we just know that it's going to take more than one. And there's a suggested time frame of an interval of weeks apart or months apart. But again, if we are practical and realistic, there's no pressure to do them back to back to back to back. And you can get your results. You've seen patients that have done, say, a series of 2 or 3 treatments, say at age 18, and then they re-enter their workforce, and then they've got maybe a few extra saved dollars, and then they do some treatments at age 23, and then they come back and they do a variety of different combination treatments in that way as well, and that works.
Yeah, it
Mhm.
definitely does. And
Mhm.
so, I love my analogy. So we often recommend a series of treatments, different types of treatments, multiple treatments, almost like when you work out your body at the gym, right? So we know you're never one workout and you're done, you're going to achieve your goals. So you do have to do it repetitively, and every time you do, right, you're going to get better and better. But unlike the gym, when you do these treatments, actually, the results are permanent, right? So let's say
True.
you get 10, 20% improvement for one treatment. There can be a gap of 1 or 2 years. Let's say life happens. You're not going to lose those results. So you
Exactly.
don't have to do them back to back to actually get to the end goal.
Okay, so let's go back to our before and after. You can see that there's probably 95% improvement. It's really significant, and that is really the key, which is it is significant and it's moving the needle in the right direction. Can we get some of these results with an at-home treatment? I really don't think so, because as we were saying before, the vascularity it's a structural component of the skin that has been recreated in that wound healing experience at that sebaceous follicular unit. And so the laser actually targets the vessel itself, and it is damaged, and then it is resorbed by the body upon damaging that vessel. So it really is a physical kind of an interaction with the laser. And I just don't think you're going to get all of that resorption
Exactly.
on your own.
Yeah, and I mean, we all know there's at home devices now, which are, like there's home microneedling, we have home light devices like the red light masks. And, although, yes, I think there is some evidence with red light masks that you can see some improvements in the tone and texture or the redness of your skin. It's a very, very, very light, mild response that you're going to get. So, and if you're really thinking about something this significant, I don't really think that you're actually going to get to the end goal.
Yeah.
It's sort of like saying, again, with our analogies with the body, that you want to really build a lot of muscles, but you're only lifting half-pound weights, right? Is it really practical? I mean, how many reps will you have to do to actually stimulate your muscle to respond in the way that you want? So I think that's the challenge with the at-home treatments. I mean, we'd all love to have the convenience of just being able to do it on our own, but I don't think it's realistic. And the one thing that we can sometimes see when people are really gung-ho and trying to get this on their own is we can sometimes see complications as well, right, of at-home treatments. Certainly we see it when people are overusing products, or they're using the wrong product for their skin type. They can trigger certain conditions like perioral, periorbital dermatitis. We've seen people using at-home microneedling devices that actually, quite frankly, become infected. We've seen with red light therapy that they're overdoing it. We actually see burns or things like post-inflammatory hyperpigmentation. So, although, again, I think it is the dream to be able to do this stuff at home on your own, I think, there's limits to what can be achieved at home.
And if you follow us on YouTube, then maybe you've seen a couple of the recommendations to keep the kitchen ingredients in the kitchen
Yeah.
and keep the chemistry of the skincare and the topical agents left to the professionals, which are scientists and chemists putting these ingredients together and buffered and intact so that they hit the skin and they are meant for the skin.
Yeah, absolutely.
Yeah. Looking at the close-up of the before, I mean, it looks like a lot of redness, but if you look really, really closely at this person's acne, there's actually multiple different things going on. There's a lot of oil that is congested and embedded in some of these hair follicular units, as well as old acne scarring, which is predominantly residual erythema and redness, but we still have some ongoing comedones as well. So really what she is having is a mixed morphology acne issue. And sometimes one leads to the other, and sometimes the acne is a little bit more superficial and a little bit more deep. So that's where an expert opinion of a dermatologist is essential to be able to come up with a medical treatment plan, or at least elicit the help of some prescription medications, whether that be topical or oral or combination. It could be a 3-month treatment, it could be a 6-month treatment. Sometimes it's a little bit longer and it's a little bit frustrating because we all want to get on to the clearing of the color and the clearing of the texture. But it really is important to clear the skin of those embedded oils before we start diving in with lasers and treatments. So,
exactly. And we always encourage people, like, you know what, just take the shortcut and get the advice, like the proper advice from the very beginning. And you'll probably save yourself a lot of time, effort, angst from going in the wrong direction.
Mm-hmm. Okay, wow, this was a great before and after.
It was.
Do we see a lot of acne?
Yes.
Yes.
Lots of acne, and it is tough.
Very
It can
tough to
be
treat.
a heartache. We know
It's
it's
tough
really
to live with.
very much a heartache, hard for people trying to live your best life, be
Yeah.
open, be out there in the world, you know, pursuing your life, pursuing your dreams, and then you get acne. So
Being mid-20s and trying to be, your next level professional self.
Yep, and
Yeah.
socially. So it's tough, but there is treatment out there. Take the time. Please do seek really good advice from the get-go. We find that it will save you time and save you stress and a lot of angst if you get yourself on the right path from the beginning.
Mm-hmm. If you have any questions about the use of Accutane, please look for and search for our Accutane videos. We have lots of good information on Accutane, which will put your mind at ease. It's still a powerhouse in our workhouse for acne treatment.
Yeah, great. And of course, we always love to hear from you. So if you have any questions about today's video or anything related, please drop them in the comments. We love to hear from you.
We do.
Thanks everyone for watching.
Thank you. Bye-bye.